welcome to Female Founder Fridays. Today on the show, we have Renee, the CEO of Hatch Compliance. Hatch is a cloud-based solution designed to simplify compliance and streamline operations for behavioral healthcare facilities. How did you come to get to this point?
So I was Chief Business Development Officer at Nisnik Behavioral Health for 5 years. When I first started with them, it was one facility, one state. By the time I left, we were in 7 states, 13 different facilities. A big part of opening up hospitals, really because they're behavioral healthcare hospitals, is compliance. Compliance, operations. You have to meet state regulations in order to open and remain open. And then just other general licensing procedures, because we deal with a vulnerable population. So there's a lot of client rights and protective advocacy services that you have to ensure are in place, as well as incident reporting and grievance reporting, and how do we handle that? So you have all these multiple areas that cross over different departments. And one thing that we found, we were spending a lot of time creating state-specific policies. And then on top of that, we had a national accreditation, which it's about 1,700 different standards and elements of performance that you have to achieve and meet, whether it be via your policy or via supported documentation for that policy or procedures that need to be intact. We started out like everyone else does, on paper, paper policies with a binder with an index, and then each different area of compliance would have its own binder with your documentation. And then we started using Excel spreadsheets. And then we realized that we were spending so much money on our compliance program. Other industries, banking, food services, construction, they have these systems where they can automate compliance. They have a central repository for policies, all of their trainings are there. So I said, why can I do this for compliance? And so I did. We've had probably like 500 people on there for the last year and a half. And just to now get their reactions to the new system is pretty cool.
How did you come to be in particularly in behavioral healthcare? What was the need that you saw?
It was almost like an aha moment. Some moment it clicked and it made sense. And then it all made sense in how it could tie together and how we could really take all these states, put together all these standards, and make one organizational policy and process for all of these things. And then Hatch was sort of the next level where, how can I do all that and also have a vantage point of how all of my facilities across the US are operating without having to send a compliance associate or a compliance officer or general counsel to each and every single one of those facilities to go through binders and binders and binders of, from things from refrigerator and medication, refrigerator logs to, making sure that the generator's being checked and the kilowattage is being tracked from month to month, or doing chart audits to make sure that, we're specifically addressing goals and objectives that are specific to the patient, is everybody been trained on overdose prevention? Has everyone been trained on cultural diversity and sensitivity? So we've really taken every angle of compliance and kind of put it in there.
And how was the process of acquiring the first client?
So I'm friends with a lot of inspectors in different states, the state level inspectors. And so I told them, hey, I called them and said, hey, this is what I'm doing. What do you think? Do you know anybody that might need this, who's struggling? Maybe they don't have a budget for a compliance team, and then you've got the clinical director doing this and the CEOs, checking refrigerator logs. And that was really the first push. And then obviously I knew people in the industry and I said, hey, this is what I'm doing. Can I come into your facility and get you guys started on this? And, you tell me what you think. And basically offered them the system for free for a long time. We had really for the last 18 months, great feedback from your lower level employees, your janitors, your behavioral health technicians that sort of manage the patients, to, the nurses, to the therapists who have to do their chart audits, and the clinical director who are doing their supervision. So we've had a consistent flow of beta testers telling us, no, this is how this needs to be done. And I need these things checked, really down to the very detail of how the form works for them.